The headlines, the issues impacting you and your family this week in Cincinnati on 9 on your side.
Good morning and welcome to This Week in Cincinnati. I'm Tanya O'Rourke. Prescription drug prices are skyrocketing, and now there's a plan to lower them in Ohio, but many say it's only going to make things worse. That's what Issue 2 is all about, and you will be asked to vote on this in November. Issue 2 would ban Ohio from paying more for prescription drugs than the U.S. Veterans Administration pays for those same drugs. That would affect areas such as Medicaid, state employment health plans, and the Department of Corrections, to name a few. Now, the main sponsor of the bill is the AIDS Healthcare Foundation. It's out of California. Nearly $14 million has already been spent by supporters and foes of this idea. Two groups are leading the debate over Issue 2. They are Yes on Issue 2 and Ohioans against Issue 2. This morning, you will hear from both sides of that debate. And joining us now is Matt Borges with Yes on Issue 2. Thanks so much for coming down to spend a little time with us. We appreciate it.
Hi, Tanya. Thanks for having me.
Absolutely. Matt, give us the 30-second elevator speech on why we should vote for Issue 2.
This is an initiated statute that's going to be on the ballot this November. Like you said, it makes sure that the state does not pay more for prescription drugs than the Veterans Administration currently pays. The state is a $3 billion plus purchaser of prescription drugs. And so those dollars that the state spends on prescription drugs and that go into the pockets of greedy drug companies instead could go into our budget. We just had to pick to fill over $1 billion budget gap this past year in Columbus, and that money would be much better suited going to schools, going to local governments, providing more tax relief for Ohioans. Instead, it goes into the pockets of big greedy drug companies who do some pretty nasty things, including not wanting to tell Ohioans who's funding their campaign.
So opponents say this measure is vague, it's unworkable, and it'll end up with more bureaucracy. So how exactly, say this passes, how exactly would this work? How would we know that someone going to have to monitor what's being paid, and how does that happen? Yeah,
that's right. That is what would happen, and it would require the state to make sure that what the price that they're getting is the lowest available price, and that's what right now we know. The Veterans Administration has a 24% discount because back in the early 90s, the drug companies were ripping off veterans and gouging those prices. And so Congress enacted an act that would that required them to have a 24% discount. And they've had that ever since, and it's worked perfectly fine. Keep in mind, there's one thing that's very important to understand. The people that want you to vote no on this are the drug companies who made $711 billion in profit over the last 10 years. That's what their own analysis tells you that they really are interested in protecting. It's not about patients. It's about their profits.
Now, they're very clear on their website that they are funded by Pharma, which is an LLC group, and it's mostly pharmaceutical. It's all pharmaceutical companies, so I do want to put that out there. Now, the organization, I want to ask you about what someone like me, someone who has employer health care. My employer helps pay my health care. So would this affect or help me in any way, shape, or form? Well,
first of all, you're a taxpayer in Ohio, and so instead of maybe paying more or not getting tax relief like we weren't able to provide in this last budget, your tax dollars would go to things like schools. Your tax dollars would go to things like police departments, other things that none of us mind paying for as long as we're being charged at the right amount. Instead, what happens is too much of our tax dollars goes to the pockets of greedy drug companies who have worked out a situation where right now the federal law prohibits the federal government from negotiating prices with them. So there's no free market in this space. They say what they want to charge, and then the state has to pay it, and you as a taxpayer have no choice but to fork that money over unless we change the law. Now, your question about what about private insurers, people who are on private insurance? That's exactly why the drug companies will spend whatever it takes to try to defeat these kinds of reforms. In their own analysis, in a trade publication that we have a copy of, they say that their concern is not anything about veterans, not anything about prices going up for anyone else. It's about the fact that if Ohio enacts this kind of legislation, that other states will want to do it too. And the federal government will want to do it too. And then private entities like insurers would demand the same prices, and that's what they don't want to do.
There is some concern by many that if Ohio gets prices at the same level of the Veterans Administration, that either pharmaceutical companies will say, hey, you know what? Not interested in working in Ohio. We're going to pull our product out of Ohio, or we'll just elevate our prices even more so that 24%, it really is a wash for us.
Well, so there's two things to keep in mind. One, when Congress imposed that 24% discount on the VA in 1992, drug companies didn't stop selling drugs to the VA, they still make a very handsome profit even at the discounted rate. And the other thing that's important to know, that's important about that question, is all of these negative things that the other side say might happen if this act is passed into law, when the voters take the power into their own hands this November and vote to enact this policy. All of those things are what the drug companies would do to Ohioans if they dare cut into their profits. It has nothing to do with what the act would actually do. They're talking about they want you to be afraid of the things that they would do in retaliation. It's very, very important to remember that it's the big drug companies that want you to vote no.
The AIDS, let me make sure I'm saying this correctly. The AIDS Healthcare Foundation is funding the campaign, your side of this campaign.
That's correct.
Why? What is it so important about Ohio that because they failed in California, Prop 61 failed last year. Why try Ohio?
So the AIDS Health Foundation is working all over the country and all over the world, saving hundreds of thousands of lives and doing great work, and we're very proud of our organization, and we have absolutely nothing to hide about them, unlike the other side who doesn't want to talk about who's funding them. But I think this is an opportunity for Ohio to be a leader. Everybody recognizes that Ohio is a bellwether state. And so if a state like Ohio takes the power into their own hands, a lot of other states will follow suit. And one thing that makes us very different from a state like California is the environment that we're in right now, where we have so many people who are hooked on opioid prescription drugs and the challenges that that's presented. And don't forget, that forest fire was lit, it was started in Ohio by big greedy drug companies over-prescribing opioids, knowing what they were doing at the time, and by the way, they still are.
Am I correct in understanding that this will really only affect the drugs that the VA actually buys, correct?
Yes, and everything else the state can continue to buy at its current rate.
So things needed specifically for women or children, that will not be affected in a price lowering at all.
That's right. The VA formulary might be a little bit light on some of those kinds of things. There is a massive overlap between. We were with the director of pharmacy at Ohio State, and I asked him what the overlap between the drugs that they purchase and the drugs that are in the formulary, which is all online. You can look at the drugs that they purchase and the price that they pay at the Veterans Administration, and they said it was about a 95–99% overlap. It's very, very close. There certainly are some, but that doesn't mean that the state can't continue to purchase those drugs.
All right, Matt Borges from supporting Issue 2. Thanks so much for being with us today, coming down for Columbus. We really do appreciate it.
Thanks for having me.